is taking part in a new clinical study involving COVID and cancer patients. As Local 24 News reporter Jenny DiPrizio explains, the National Cancer Institute began the study to help scientists learn more about how the coronavirus impacts cancer patients undergoing treatment.
I always say, if I did catch it, I'm going to survive it.
Angela Palmer tries her best to be optimistic about COVID-19. The breast cancer patient went through chemo and radiation last year.
I do take precautions, and I know there's not 100, but it helps, and I do limit contact with the outside world.
The patients who are undergoing active treatment, especially with chemotherapy, tend to have more serious infection, more serious issues related to the COVID virus. Patients who have recovered from cancer, whose immune systems have kind of healed up from some of the treatments we have to give for cancer, seem to do better.
Dr. Phil Lammer says that's what early research has shown, but Baptist Healthcare is now taking part in a new clinical study regarding cancer patients and COVID.
Patients who will be enrolled are patients who are newly diagnosed with COVID infection, but have cancer and are undergoing active treatment for their cancer.
This study will follow cancer patients for 2 years with the hopes of answering scientists' questions about how COVID-19 impacts cancer, as well as cancer's impact on the course of COVID-19.
How the virus affects certain patients with cancer, how it affects certain cancer treatments. Are there certain cancer treatments where patients tend to actually do better if they, have the COVID outbreak?
Lammer says the study aims to enroll 2,000 people with COVID and cancer nationwide. As for Palmer, her advice to anyone with an underlying condition:
stay protected, stay strong, and stay uplifted. This too shall pass.
Jenny DiPrizio, Local 24 News.